Adrian Beret, Sports Physio here to help you treat and look after patellar tendinopathy pain. What is patella tendinopathy? Well, the condition goes by a number of different names: Patella Tendinitis, Patella Tendinosis, knee tendinitis, jumper's knee. Physios tend not to use the term tendinitis anymore because we know that it, in most cases, is not an inflammatory condition. It's actually a degenerative condition where the tendon tissue is suffering from wear and tear and is no longer able to manage with the stresses of sports and activities of daily living. Pain is felt within the patella tendon, usually just at the base of the kneecap, and is worse with vigorous activities such as jumping and landing, hopping and taking stairs. At its worst, it can be extremely debilitating and stop sports participation, but usually there's little or no pain at rest. How does it develop? Like other tissues in the body, as we are active and use our muscles and tendons consistently, they become strong and resilient. As we get older, typically, our strength and activity levels decline, the tendon structure starts to deteriorate, and parts of the tendon lose their capacity to transfer muscle force. Now the tendon is vulnerable to sudden increases in activity, such as a return to sport after a long break, unfamiliar vigorous physical training, sometimes work or normal home activities, and quite trivial loads for some people who are not usually that active. Essentially, when we place more demand on the patellar tendon than it is used to, there is a greater risk of tendinopathy resulting. Pain occurs when the brain registers that there is a mismatch between the capacity of the tendon and the demands placed upon it as a threat of imminent tissue damage. Who does this happen to? Well, as the name jumper's knee indicates, this condition is prevalent in sports such as basketball, volleyball, triple jump and netball. It can also occur in other sports such as cycling, where there is a heavy and repetitive demand on the tendon. We often see it in older adults who may have participated in these sports in the past, have suffered from degenerative tendon wear and tear over time, and then exacerbate the problem with a sudden increase in loading. How to identify the problem? Well, many knee conditions present quite similarly, but there are a few key factors that would likely indicate that the tendon is the problem. First of all, an increased loading over a short period of time. Number 2, pain with jumping and landing. Number 3, pain and particularly weakness with specific physical tests such as a single leg squat and especially a single leg decline squat. And number 4, the tendon is usually exquisitely tender to palpate right where the tendon joins into the kneecap at the base of the kneecap. What to do about it? Well, physiotherapy modalities such as ultrasound, medium frequency current and friction massage can all provide short-term relief. A patellar tendon band can provide good local support and compression, can also relieve pain during sports and physical activities because it changes the line of pull of the tendon into the kneecap and creates local compressive support. However, it's probably not a good idea in the long term because that compression is going to retard the local blood flow, it's going to slow down the rate of tissue healing, and obviously it's not addressing the ultimate cause of the problem. In the acute phase, the knee will need relative rest, meaning a reduction or a cessation of the provocative activities. If the knee pain is quite strong and easily set off, then you'll need a significant reduction in loading. If the knee pain is less severe, then a smaller reduction in loading may be appropriate. It is very rare to advise complete rest, as this will weaken the tendon and ultimately cause the problem to take longer to get better. Ultimately, the best way to fix patella tendinopathy is with a progressive resistance exercise program. Initially, these exercises will be less dynamic and may need to start with isometrics, which are strengthening exercises without movement. These are very good at providing pain relief as well as a strengthening effect, and they will need to be done daily in the early stages to kickstart the repair process. Gradually, the program will need to include more and more difficult, ballistic and vigorous exercises until eventually you're mimicking the full demands of the sport or the original causative activity. As you are building strength, you'll need to do these exercises 3 to 4 times per week until you move into a strength maintenance phase when they can become less frequent. How to stop the pain recurring? There are a few considerations to reduce the likelihood of Patella tendinopathy recurrence. And the first one is to respect the acute-chronic ratio of activity loading. And this means that the physical load or the sporting load on the knee or the tendon should not increase by more than about 10% per week. And remember that there are many different parameters of loading, such as frequency, duration, and intensity. And if all of these are increased by 10% or more, then the actual increase in loading is a multiple. Number 2, if your tendinopathy has settled, then it is important for you to continue with a maintenance dose of tendon strength exercise about once per week. If you are in an elite sporting environment, this may need to be more frequent. This ensures that the tendon remains strong and resilient and does not suffer from more disuse-related deterioration. Number 3, see your physio on a periodic basis to make sure that your strength measures are being maintained. If they detect a small reduction in your functional ability, then a short burst of treatment and a revision of your exercise program may help to ensure that you don't suffer a full-blown relapse of your symptoms. Ultimately, it's important to understand that the tissue changes in a tendinopathy condition that cause tendon pain are long-term, and they're not going to be changed in a short period of time. They require a long-term commitment to manage to maintain your functional ability.